Welcome to Chapter 5, Video 5. In this series, we're going to discuss cardiovascular disease. Cardiovascular disease is a dysfunction of the heart or blood vessels, and it can result in a heart attack or a stroke. The three most common forms of cardiovascular disease are coronary heart disease, stroke, and hypertension or high blood pressure. Atherosclerosis is a disease in which the artery walls build up lipid deposits and scar tissue, impairing blood flow. The stiffness that results is commonly called hardening of the arteries. Because the arteries are hard, the heart must work harder to push blood through the vessels. This is a diagram here of different arteries. If you look here at a nice artery wall, in this particular artery, it is nice and clear, and there's a nice wide passage for blood to flow. Over on the other side here, on the other hand, if you look at the artery wall on the outside, the inside of the artery is full of plaque, and it really narrows the space that's available for blood to flow through. Now, hypertension is a major chronic disease in the United States. Optimal blood pressure is 120 over 80. Now, 120 is what we call the top number or systolic, and 80 is the bottom number or diastolic. So again, the optimal blood pressure is 120 over 80. As those numbers increase, we start to progress towards hypertension. It functions as a warning sign for a person's risk for developing heart disease or a stroke. For many people, hypertension is hereditary, but for others, it can be induced through poor nutrition and exercise habits or a combination of poor habits and hereditary. So in other words, just because you have a high blood pressure in your family doesn't mean that you're destined to get it. You might be able to prevent getting the disease through proper lifestyle choices. I should also mention that some forms of hypertension are what we call salt sensitive. In other words, for some individuals, if they consume a diet high in salt, their blood pressure rises, and if they limit their salt intake, they can actually control blood pressure by controlling salt intake. Now, risk factors for cardiovascular disease include being overweight, being physically inactive, smoking, having high blood pressure, having diabetes, and having high blood cholesterol. Now, the intake of certain types of fats can protect against heart disease. Diets that are high in omega-3 fatty acids, along with moderate levels of physical activity or exercise, can actually reduce inflammation of our blood vessels, and it can increase the good cholesterol levels, which are the HDLs. The LDLs, the low-density lipoproteins, are often called the bad cholesterol because their role is that they transport cholesterol throughout the body, and it's these LDLs that tend to play a role in depositing cholesterol in the artery wall and helping to form those hard plaques. Now, the blood lipids include chylomicrons, VLDLs, LDLs, and HDLs. Now, if you get a blood test done at a doctor's office, you generally won't see numbers for chylomicrons or VLDLs. Most of the numbers that you're going to see are total cholesterol, LDL, and HDL. And if you remember, the LDL is the bad cholesterol. We want to keep that one low, and the HDL is the good cholesterol, and we want to keep that one high. Now, diets that are high in saturated fats, they tend to decrease the removal of LDLs from the blood. Under normal circumstances, the liver has what we call LDL receptors, and as those LDLs are formed, the liver can take some of those up to keep the level of bad cholesterol in the body normal. We think that saturated fat, if the level is too high in the diet, it tends to somehow play a role with that LDL receptor and prevent the liver from taking up the LDLs, and therefore the levels rise. As those levels of LDL rise, they contribute to the formation of plaque that can actually cause your arteries to block. Now, if an artery is partially blocked, blood flow is going to be difficult, and once an artery completely blocks, if it's a main artery, it can cause a heart attack, and that means blood flow to the heart has been completely blocked. Now, we also have to pay attention to our triglyceride levels, and diets high in saturated fats not only raise our LDLs, but also raise the level of total triglycerides in our body. Please refer to this diagram in your textbook. I'm only going to spend a couple minutes on it, but here it's illustrating the components of the lipoproteins. Those chylomicrons, if you remember, those are the vehicles that carry our dietary fats. Those are very rich in triglyceride. The LDL molecules that are a byproduct of metabolism, those are very cholesterol rich, and that's why we want to keep those in check. If there are too many LDLs floating around, some of that cholesterol gets deposited in the artery wall. Now the HDLs, on the other hand, are primarily protein. And another way to think about the HDLs are as little scavenger molecules. What the HDLs do is they kind of go around and remove cholesterol from the artery wall and help dispose of it. So again, those HDLs are the good cholesterols. Now, as far as recommendation to improving our blood lipid levels, there are several things we can do. One thing is to look at our total fat intake, keeping total fat within 20 to 35% of your daily calorie intake. Now, notice this is a wide range, and it's really important to pay attention to the types of fats that we're eating. There's nothing wrong with eating 35% of our total calories from fat, as long as those fats are healthy sources, like we talked about earlier, omega-3s, polyunsaturated, monounsaturated fats. It's important to decrease your dietary saturated fat to less than 7% of total energy intake. Either make sure your trans fat intake is either limited or avoided. And then finally, increase your consumption of dietary omega-3 fatty acids from foods like green vegetables and fish. Now, as far as recommendations to reduce blood pressure, we talked a little bit earlier about salt consumption. Some people with high blood pressure are what we call sensitive to salt. So by reducing salt consumption, if you improve your blood pressure, that is certainly a first step to try. Another thing is what we call the DASH diet, and the DASH diet stands for Dietary Approaches to Stopping Hypertension. And this is a diet that's actually quite simple to follow whether you have hypertension or not. But the key with this diet is actually limiting our salt intake, and then in addition to that, paying attention to the other foods that we're eating. The DASH diet is reduced in sodium, and it's rich in fruits, vegetables, whole grains, and low-fat dairy foods. If needed, using doctor-prescribed medications can help control blood pressure, but it is important to be under the care of a physician if you're considering medication. Individuals that need specific help with their dietary needs to help either control blood lipids or blood pressure can seek the advice of a registered dietitian. This brings us to the end of the lipids chapter. So I just wanted to remind you that in addition to the videos and in addition to the chapter in your textbook, please visit the My Nutrition Lab website. This website has additional materials for you, such as supplemental videos, self-quizzes, and reviews to help you master the material at a higher level.